STI testing has become like this huge buzzword. बट अभी भी काफ़ी कंफ्यूजन है कि किससे, कब और क्यों टेस्ट करवाना चाहिए। और आज मैं इन्हीं सब सवालों के साइंस बैक्ड आंसर्स दूंगी। वेलकम टू एपिसोड 4 ऑफ रीड बिटवीन द शीट्स। मैं हूँ संपदा, आपकी सेक्सुअल हेल्थ थेरेपिस्ट। ओके, सो क्विक रिफ्रेशर। STIs or sexually transmitted infections are infections that can pass on from one person to another during sex and sometimes even during kissing and skin-to-skin contact. In fact, a lot of STIs can also occur due to sharing of needles. But that's all they are, infections, most of which that can be easily treated. Okay, pay attention. I want to share some really important facts. Almost all STIs are easily treatable. That's right. That means कि आप medications खा के ठीक हो जाओगे. But here's the catch. If not treated on time, most STIs can actually cause issues, become difficult to cure, and cause long-term effects on your reproductive health. Now that you have understood this, it's also important to know कि कई सारे STIs के कोई symptoms नहीं होते. I know it's strange, but it's true. This means कि most STIs can also be asymptomatic. इसका मतलब ये है कि आपको कोई symptoms feel नहीं हो रहे होंगे, लेकिन infection होगा. HPV, chlamydia and gonorrhea are some STIs that exist with zero symptoms. अब आप पूछोगे कि अगर symptoms है ही नहीं, तो कैसे पता चलेगा कि टेस्ट करना है या नहीं? Right question. I'll tell you. You need to get tested if A, you had sex with more than one partner without knowing their STI status. B, if you had sex with a new partner without a condom. C, if you had sex with a partner with a known STI, you must book yourself a test. And D, your condom broke. This doesn't mean that you actually have an STI. It means that you're at risk for one, which means you could have one. The only way to find out is to get tested. I know it sounds scary at first, but we promise you that you're gonna be just fine, no matter the outcome. Other than that, sexually active folks should get tested between partners or every 6 months, even if you're using a condom, because STIs can be transmitted through kissing as well as skin-to-skin contact. Now, most importantly, when should you get tested? 2 words: window, period. This is the number of days or weeks before an infection is not even detectable by a test. This is very important to keep in mind, as testing before the window period might make you think that you don't have an infection, when your infection was simply not detected due to when you got tested. Each STI has a different window period, but obviously it is not efficient to get tested again and again, which is why we suggest a pre-test consultation with a sexual health expert, because A, they'll help you understand whether or not you even need to get tested based on your sexual history. B, which tests to get done based on presence or absence of symptoms. And you may not even need to buy all the tests. And C, most importantly, when to get tested based on different window periods. Lastly, STI testing is available at many local centers and hospitals. We recommend choosing a test provider that keeps your information 100% private and confidential. We offer both pre-test consultation and STI testing in 35 plus allo clinics across India. To know more about this, read the description. I hope अब आपको clear हो गया कि STI testing सिर्फ एक precaution नहीं, एक responsibility है आपके और आपके पार्टनर के ओवरऑल वेलबींग के लिए। अगर आपको ये वीडियो हेल्पफुल लगा तो लाइक करें, शेयर करें और कमेंट्स में अपने क्वेश्चंस पूछिए। Stay informed and remember that sexual health is a part of self-care. See you next week for another candid chat on Read Between the Sheets.